Hello students, myself Dr. Rajesh Darade. I am the gynecologist and obstetrician and registrar of College of Physicians and Surgeons of Mumbai. I welcome you all for this simulation lab, which is the first lab of stimulation in Mumbai region. This is established by College of Physicians and Surgeons of Mumbai. Now this is a high fidelity simulation lab. Now what do you mean by high fidelity simulation lab? High fidelity means this simulation is as good as normal person. Means like a normal living person, we cannot do 100% on the simulation. There are restrictions and we have tried our level best. That's why it's called a high fidelity simulation. Now this is a Lucina. This is a Lucina. In this, what we different things we can see now. Now basic aim of the simulation lab is to different scenarios we are going to create, and after the scenarios how to manage the case, everything we are going to manage. Now step by step I will go, so from top to the bottom. In the Lucina, what we can see the eye movements. You can see color of the eye, if there is a jaundice, if subconjunctival hemorrhage, you can see the pupillary reactions. And if you come down, you can do like oral cavity, we can do intubation of the patient. She can take respiration, we can auscultate both the sides, you can auscultate the chest. Suppose this Lucina is having pregnancy along with some chest problem, that also can be auscultated and can be seen. Plus this any abnormal things like air entry is less or anything is there, that can be detected. If you come down, then in the abdomen you can see the pregnant uterus. I mean, you can see difference, you can see fetal heart sounds, you can see different murmurs also you can see. Now this is like a pregnant uterus. Now this is a baby. Now this is a baby. Now this baby is having everything like a normal human being. I mean normal baby. That now different scenarios, what different scenarios we can create, like normal delivery you can do, breech, then postpartum hemorrhage, then eclampsia, severe PIH, all these things we are going to demonstrate in this Lucina. But there are like restrictions. Suppose there is like PPH, there is some bleeding, but that will not be like a natural bleeding. But we have start like mimicking to the natural. So all these scenarios, what you are going to do, you are going to handle Lucina very careful, as if you are handling a living patient, live patient. So you have to take care while doing this, handling the Lucina. You have to wear gloves, don't touch here and there, because even you can see the pulsation, carotid pulse, brachial pulse, then you can see radial pulse. So all these pulse can be recorded. Plus all the leads will be, there will be like monitoring of this fetal heart sounds, like fetal heart sounds can be monitored. Then NST, non-stress test, cardiotopography, that also can be monitored. Now this is the monitor, and on the monitor you can see monitor of the fetal heart sound, whether there is any accelerations, any decelerations. Depending upon that, we can see. This will be monitor. I'll just show the monitors, how the on the monitor also you can see pulse, BP. Then you can see the graph also, NST graph you can see. There you can make out fetal heart sounds, whether there is acceleration, decelerations, and from that also you can make out whether there is any fetal distress. And accordingly you have to manage. So now henceforth, when you will come for the different scenarios here, there will be faculties, myself, Dr. Meghna Andankar is there, plus there are other faculties, they will come and demonstrate each time. First, initially we'll introduce about this Lucina. We have got a good technical people, they will teach you exactly about the Lucina for first few hours, and then will orient itself, and then you give the different scenarios. In that scenarios, you have to work on that. Then after the scenarios, we will have debriefing, something known as a debriefing. In this, what we'll see in the debriefing is, what is the management, how the management is going on, whether it went on smoothly, whether there was any problem during the management, and discuss what was the problem and how will you manage this. So this about overall idea about this Lucina. So this is, I think you all people are very lucky, because CPS is the first institute in Mumbai who has started the simulation, high fidelity simulation lab. On this you can learn many things. Apart from this also, there are many things about chest, for example, having respiratory problem, cardiac arrest, all these also can be managed in this. So this is about the short about the Lucina. I hope you'll enjoy and you'll learn many more things in this. Thank you.